Everyone. I'm Janice Wood. Welcome to a Senior Citizens Forum. And today, I'm going to start over.
No worries.
I can't believe that. I'm so busy trying to do all this stuff and it's the end of the day. Oh my God. Okay.
No worries. Take your time.
Okay. I'm going to I'm not going to go completely out. I'm going to just start it from this point. Okay.
Okay.
Thank you for your patience. Okay.
No worries.
Hi, welcome to a Senior Citizens Forum. I'm Janice Wood, your host, and a Senior Citizens Forum is being sponsored by Benefits for You 2 Insurance Services, where they provide Medicare insurance plans like Medicare supplemental plans, Medicare Advantage plans, and prescription drug plans for people that are 65 years of age and older, or for people that are younger than the age of 65 that have certain qualifying disabilities. Today, we're not here to talk about Medicare insurance. We're going to talk about dentistry. Why is oral health so important for our health, especially as senior citizens? It's important for you for when you're younger, but it's also important for you when you get older.
Well, thank you for inviting me back, Janice, and it's a pleasure being here.
I know you've been on the Senior Citizens Forum before. We've seen that a lot of people have watched your show before.
Thank you.
And I'm happy that you're going to be a regular on a Senior Citizens Forum, probably about, I'm hoping on a monthly basis. You're going to come in and do some more talks about why oral health is so important to us.
Yes.
And we'll talk about more about our series later on. Um, but let's get started and let's talk about why is oral health so important for seniors.
Well, not just for seniors, but oral health is important for everyone, right? Well, it's true that especially for older patients, uh, oral health is something that you really need to watch. One, it could be sort of a window for your overall health. Some of the systemic disease can be manifested orally, or if you have a poor oral health, that could affect your overall systemic health as well. So it plays both ways. So having good oral health not only helps you to have good systemic health, but also if you have any systemic disease or problems, that it could be shown up in your oral cavity. That could be an indication for you to go visit not only just a dentist, but also a doctor to have proper treatments or
So, what
proper
do you,
diagnosis.
okay.
Yes.
So, my question is, what do you mean by systemic health?
Yeah. So basically, you want to. It's your overall health. So, for example, if you have, uh, let's say, if you have any lack of vitamin in your system in your health, then it could show up as a poor gum health, and that's an indication that you may not be taking proper vitamins or proper nutrients to supplement your overall health. So that's one indicator as to whether you have a good overall health or not. That is to say, your oral health is an indicator as to how healthy you are overall.
Okay. So, what are some of the common problems for seniors? And I'm sure some of the problems are the same for people that are younger. Okay.
Right, right.
So, what would be common problems that you would see in seniors?
Well, in seniors, oftentimes I see a lot of I deal with a lot of geriatric patients, and oftentimes it's they had the dental disease and periodontal disease, that is a gum disease, over throughout their lifetime, that they may be lacking in number of teeth for them to function with. That is to say, they may not have enough teeth to chew their food properly. What that does is if you cannot chew your food properly, that puts a lot of stress on your digestive system. So, in order for you to digest your food, you want to properly chew your food, and that in turn will allow your stomach to have less easier time to digest food and provide nutrients for your whole body. So that's one aspect of oral health that I see in a lot of the geriatric patients, having lack of teeth or number of teeth to chew properly. The other aspect of oral health for seniors is that they're taking a lot of medications. So when you have a lot of medications that is taken for your systemic conditions such as heart conditions or hypertension or even diabetes, some of those medication can affect your salivary flow. Uh, well, that's one aspect of it. But when you have lack of salivary flow because of the medications that you're taking, then your teeth are not properly cleansed, and if that's the case, then you have maybe a higher rate of plaque buildup, which may in turn cause dental decay or periodontal or gum disease. And so that is another aspect of oral health and systemic health playing together, especially a lot of those patients with the chronic disease that require a lot of medication. So those are the kind of things that I'm looking for in terms of helping my geriatric patients.
Okay. One of the things that you mentioned is, and I know they seem to catch that when you do blood tests, is when you
Hmm.
have the right amount of, let's say, vitamin D,
Yes.
or you may be lacking potassium
Yes.
or other nutrients because you're not chewing correctly.
Yeah.
have the lack of teeth, or maybe it hurts to chew. Okay.
Yes.
Okay.
Yeah.
Uh, so we're not getting the proper nutrients because it's not being digested properly.
Right. And so, when you cannot when you don't when you don't have your food properly digested, you're right that we don't have right amount of or proper nutrients getting to your body to either to heal or to supplement whatever needs that you have. So that it's important that you have a good dental health as well as your oral health, so that you can properly uh, 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 have a proper diet for your systemic health.
Okay.
Uh,
So it's when I think of oral health, I'm thinking of dental health. So is there a difference between the two?
oh, sure. So, yeah, your oral cavity is not just. Well, it just doesn't involve. It doesn't involve just your teeth. You also have your gum. Underneath the gum, you have your what we call the alveolar bone, and that is the bone that holds the roots of your teeth. And then you have the mucosal linings. That is the tissue, soft tissue that's lining your oral cavity. So any of those structures, if they are damaged or they're affected by the systemic disease or any other adverse reactions from the food or whatever you may take, then it's gonna play a role, or it's gonna play an adverse role in taking food in. If you just have a sore spot in your mouth, it's very difficult to eat, right? It hurts to eat.
Right.
So, or if you have a dental decay, then you cannot bite down on your teeth, and that means you cannot chew your food.
Okay.
You may not be able to chew on a very tender steak that you may like, so that you can properly, not only chew but to swallow that food. So it's important that you keep all those structures healthy. So it's not just the teeth that you're taking care of, but you're also taking care of the gum, the bone, the nervous systems, the mucosal linings, and everything else that comes after that. Maybe even if you're let's say swallowing big bolus of food because you couldn't properly chew or break down the food. Now, if it affects maybe the esophagus, the esophageal lining, that's the tunnel that goes from your mouth all the way to the stomach, right? So yeah, so your oral cavity or health, having a good healthy oral cavity means a lot for the your overall digestive system and your overall health as well.
I mean, I always think you always think about uh, when I think about dental, I'm always thinking about teeth.
Yes.
And we forget about it. It's the gums and the structure, or like if you
Yeah.
get what I always would call a canker sore,
Sure.
your misery. That's all part of the oral health.
Yes. Yeah. Especially when you have uh, uh, lot of gum disease because of the plaque buildups. Let's say you didn't have a proper oral hygiene regimen at home or with the professionals, then because of the plaque buildup, you naturally have a lot of inflammation in your gum, which is called the gingivitis. So when you have a lot of swelling in your gum, now you have a tenderness in the gum. So when you have tenderness and swelling of the gum, when food catches those tender spots, it's going to cause pain, and because of that, you're not going to be able to chew properly. um, just like having, like what you said about canker sore, having a canker sore, can be really painful when you drink anything like citric, or salty. When those kind of food comes in contact with those canker sores, it can really affect or cause a lot of pain for you. So yeah, having a good healthy oral health, having a good oral cavity, a healthy oral cavity means a lot for your overall health.
Yeah, and being able to maintain it
Y-
is
yes.
and I know me, I've been very fortunate in my lifetime that I've never had a problem going to the dentist.
Hmm.
Okay. And I was very fortunate that my mother was ahead of her time.
Yeah.
She made sure that we had braces when it was needed. Okay,
Mm,
but even if those things that if you have problems as a child and it's not taken care of,
mm.
they don't go away when you become a senior.
Right. Well, there's a Korean saying that the your habit when you're 3 years old goes to well, will last till you're 80 years old or something like that.
Right.
That means having a good proper uh, oral hygiene habits when you're young. It will play a big role in your oral hygiene throughout your life. So having to learn how to take care of your teeth when you're young, it means a lot, especially when you get to older age where you had used these teeth and for a long time to chew your food. It might have damaged the teeth quite a bit, and especially if you had poor oral hygiene, that may have affected the gum that's holding and the bone that's holding your teeth. Uh, might have been that you may not have a proper health of those structures. Then now you run into a severe gum disease, and that can cause the early exfoliation or the needing to extract the teeth in earlier age than later. So that's a good that it's having a good oral hygiene also means that you will be able to keep your teeth for a long time, and that you'll be able to use them for a long time to chew.
So,
Yeah.
okay. But as a senior,
Yeah.
I'm definitely a senior. Okay. I know I had a hiatal hernia that
Mm,
caused was it acid reflux?
yes.
Yeah. So I know I didn't have it as bad as a lot of people had it, but I can imagine all that acidity getting up into the mouth.
Mm,
Uh,
yeah.
That would that affect the oral cavity and the teeth?
Yeah. So, um, having the acidity or having your mouth become acidic it's a detrimental to your dental health. Um, so your dental decay happens because of the acidity that is produced from the bacteria or all the byproducts of the bacteria, or even from food. So mostly the food is not really the main. The sugar is not may not be the main cause, but the sugar um, kind of feeds the bacteria that produces a lot of bacteria, a lot of acid, and
Hmm.
having a lot of acid means that that your teeth are more prone to dental decay because it's going to melt the dental structure. So especially those patients like you just mentioned who has gastric reflux will have a lot of acid coming back up to the oral cavity from the stomach, and that can affect the prevalence of the dental cavities. We used to see a lot of bulimic patients who would have gastric reflux always kind of present in the mouth, or have an excess amount of gastric acid in the oral cavity. They have what we call the chemical erosions of these teeth. So enamels basically melt away because of this acid that's present in the mouth. So having the good control of the acidity in your mouth is an important thing. So that's where the oral hygiene comes from. Having, like I said before, having just food causes the mouth to become acidic. So brushing your teeth and washing out the any food or plaque buildup that might be over your teeth and gum or even your tongue, it will help you to maintain the balance or pH balance or of your mouth, and help to prevent the dental decay that much more.
Okay. I also noticed that as for me as a senior, I noticed that the spacing in my teeth have changed. And
Yes.
where I didn't used to have food get caught before, the food is now getting caught in between
Mm,
the teeth. And I know you would call it interproximal spaces, okay?
yeah.
but it's caught in that. And so I get in there and I try to dig it out, and then
Mm,
I get lazy and I don't dig it out, and then it really hurts later on.
mm.
And and I know that's a common thing for seniors who are lucky enough to have their own teeth.
Yes. Yeah. So, as we're talking about how we don't want to have a whole lot of food remaining in the mouth because it can cause acidity, that's why we want our patients to be very diligent about flossing or using interdental, what we call the proxy brush, to get in between teeth to remove the food and plaque. Um, you're right that the as patients get older, they do end up with a little bit wider spaces in between teeth. One, because teeth might have moved due to gum disease. Having lack of support for your teeth will cause the teeth to move. And now, once teeth start to move away from each other, now you have more space for the food to get in. Another reason maybe that there's a lot of recession of the gum and the bone, that you actually start to have more spaces in between teeth. Now you have more space for the food to get in, plaque to build up. So that's why you need to really get in between teeth to clean. Uh, and get rid of those plaque and food, so that as we talked about the acidity of the mouth, you can reduce the acidity possibility of these food, constantly feeding into the bacteria, causing producing a lot of acid or byproducts that are acidic. So, yeah. So for seniors, yes, you do have a lot more spaces, perhaps potentially, but it just means that you will have to be spending a little bit more time, more effort, spend a little more effort to get rid of food, so that they don't remain in between teeth and cause dental decay.
Yeah, because I notice when I look at my teeth
Uh-huh.
and see the receding gum lines,
Yes.
I see that there's more root exposed.
Yes.
Yeah.
Yeah, it's a chronic situation, so it's not something that's acute. So yeah, it could happen overnight or over a short period of time for younger patients, but mostly for the seniors, or geriatric patients or seniors. These things have happened over decades. Uh, so just maintaining or managing the spaces will be the key to having a good oral hygiene. That is to say, nowadays we recommend water pick rather than just flossing and using the interdental toothbrushes. That's because sometimes flossing and using the interdental toothbrush may dislodge some of the food, but not really remove it completely. But having a pressurized water, like going through the space to flush out, whatever you have loosened up in between teeth, will have a much better result in remove. Will have more complete removal of the plaque and food. So that'll be a good thing to have. Do you use water pick, Janice?
No, and I'm thinking maybe I should get a water pick because
Yes.
I mean, I use the dental floss and I have this little thing with a little rubber tip at the end of it,
Yes.
little,
Yes.
a little brownish red tip. And I
Yeah.
get in there and I poke through because I feel like it's another lifetime. I was a dental assistant, so I'm not
Right.
afraid to go in there
Mhm.
and dig.
Yeah. So I know you have a lot better understanding as to how the oral hygiene works and how important that is. So it is. I guess that's why we're here. We want to pass on the same information and remind our patients of the importance of good oral hygiene, especially for seniors.
Yeah.
Yes.
I would think the water pick would feel really good.
Yeah. I use it time to time. I don't have as much of space as some of the older patients that I've seen. Uh, but it refreshes your mouth more so than just that swishing with the let's just say mouth rinse or something. Mouth rinse has a lot of these minty tastes that they'll freshen your breath and makes you feel like you have a fresher breath, but uh, it doesn't really get in between teeth to really flush out the plaque or even provide fluoride so much. But if you have water pick, I think you will see the benefit of using it once you start seeing how much food comes out of the space between teeth.
Right. And what I'm a little crazier than most people. I take a mirror that that magnifies.
Oh yes,
Okay.
sure.
And I look at my teeth, and if I'm just standing there brushing and looking at the regular mirror, I'm not
Mm.
seeing all the stuff that's around the gum line.
Yeah,
So
so
when I
that's another issue with the geriatric patients.
yes,
Because the eyesights are not as good as what they used to be. So they think they have brushed well, and they think they remove quite a bit of plaque, and they've done a fairly good job of
mhm,
hygiene at home. But one thing I'll tell patient is that they use the tongue. If you have a use your tongue to just kind of go over your teeth and make sure the teeth are feeling smooth. Um, then you know that you have removed the food or plaque that had built up over teeth.
yeah.
But if you just kind of go over the teeth with your toothbrush and not really, have a system to check whether you have done a fairly good job or not, then there comes a problem because you might have missed something and you don't even know that you have done,
So
you have something still built up on the tooth.
so I have this magnifying mirror that I
So
use,
that's good. That's
and
good.
I will look in there, and I'm going, I didn't see all that stuff.
Yeah.
And
Yeah.
I find if I take one of those little tips that have a brush at the end of it,
Sure. Yeah.
get a whole meal out of
Yeah.
out of there almost.
Yeah, so nowadays that's why a lot of the dental offices nowadays have oral camera uh, that we take pictures of the patient's teeth to show what they have in their mouth. Oftentimes it's a big motivation to see tartar buildup on the back of your lower front teeth that you normally would not be able to see even with a magnifying mirror or whatnot.
Yeah,
So yeah.
especially in those back teeth.
Yes, especially the molars way in the back of your mouth. Those teeth. It's hard to get to. Some of those patients who have a very small mouth and very tight corridor in their buccal or outer cheek here, we would recommend also like getting a smaller toothbrush, like pediatric toothbrush, so that
Yeah.
you can reach farther back into the tighter space. So those are the little things that we also teach our not only the general population or patients, but also seniors who are having little difficult time reaching those little difficult places, especially those patients, senior patients with the arthritic conditions. They can't quite use their hands very well to floss or brush. So another recommendation we make is uh, the rotary toothbrush or something like a Sonicare, where they have a toothbrush that actually kind of causes vibration to um, to have easier time removing plaque from their teeth.
I know I have an aunt that is going to be 98 years old. Okay.
Hmm.
And her dentist got her to buy an electric toothbrush. And I see her
Yes.
walking around with her electric toothbrush. And I keep thinking, is she going to remove the plaque from her teeth?
Well,
Not
it should help.
her teeth, the enamel from her teeth.
Yes. Yeah. So that's another thing that we always warn our patients. It's not that you have to bear down on these on your teeth with these electric toothbrushes. Let the bristles just rotate or vibrate so that the plaque will be kind of um, broken off, or at least it will be just kind of simply get removed from the surfaces. You don't have to press against the enamel with these rotary or electric toothbrushes to abrade the enamel surfaces.
Yeah.
Oftentimes we see a lot of the patients come in with the enamel all kind of abraded out or all worn out, because not because they chipped it. It's because they have brushed so hard and they scrub their teeth so hard with their electric toothbrush. We'll see those what we call the toothbrush abrasions. along the gum line, along the necks of their teeth.
Well, this also brings me to a question is on the heads, on the brush itself. I
Hmm.
like the rotary toothbrush because
Sure.
I throw it away when I get a new tube of toothpaste. I,
Hmm.
I get a new toothbrush.
That's a good practice.
I don't like because it gets all yucky looking. I mean, everything gets handled.
Yeah.
So if you have a rotary toothbrush, that's how I change it. But what about if you have an actual electric toothbrush? Should you be changing it? I mean,
Yeah, nowadays exchangeable toothbrush heads are readily available for probably all models of electric toothbrushes. The important thing is that the just like the conventional toothbrush, you want to make sure that the bristles of these toothbrush heads are staying soft and staying clean and. Um, like you're saying, not so, make sure they're not so yucky looking. I know there are devices out there like that that kind of sanitizes the toothbrush head with the UV lights and things like that.
yeah,
But like what you're doing, changing them frequently so that they don't build up with, they don't get built up with the bacteria or food, within the toothbrush head, or you know, uh, make sure that you switch them out often enough that these brush bristles do not become so stiff. Over time, they loses the elasticity or the softness to the bristles. And once that's the case, well, that becomes the case, then they are more readily they're more harmful to the enamel because you're able to abrade into the teeth with them a lot easier than soft bristle teeth toothbrushes.
yeah. Now the other time when I change my toothbrush is that when I have a cold or I have
Mm,
something when I'm sick, because I figure if I've had some kind of germ, the germ will
right,
stay on the toothbrush. So I
right,
should be changing that too. So I'm not reinfecting myself.
right. So anytime you brush your teeth and leave the toothbrush out, it's a potential spot for where the bacteria to grow. So if you didn't properly wash the toothbrush with running water, more likely that there will be some bacteria or viruses that will be left behind. So, as I said before, that's why there are some devices out there that allows you to kind of sanitize the toothbrush with a UV light to kill off the germs. But you don't have to go to that extent to keep the toothbrush clean. Just simply wash it with the running water, and normally the fluoride in the toothpaste or the ingredients that are in the toothpaste will keep the toothbrush uh, sanitized enough for you to use for a few months. But I think good uh, rule of thumb is that if you see that the toothbrush is not looking clean, then you should change it. Yeah.
Yeah. And that's why I find that I use my tube of toothpaste as my
Yeah.
gauge.
Sure. Yeah.
So,
Yeah, that's a good practice, Janice, because you certainly don't want to reintroduce the same germ that you remove from your mouth back into
yeah.
the mouth, with the brush that you just you never you never switched out.
So let's switch a little bit right now from the oral and the dental. Okay.
Mm-hmm.
Let's talk a little bit about dentistry is expensive.
Yeah.
Okay. So if I were to come in and I have experience in dental insurance. Okay.
Yes.
So if I want to come into you or the average dentist, and I know there's a difference between a dentist that takes PPO insurance to a dentist that takes HMO insurance. Some dentists take all of it. I mean, it's really confusing. And I know people get really overwhelmed by how much the dentistry is going to cost,
Yes.
get overwhelmed by how much the dental insurance premiums are
Right.
and what they're getting back for it.
Right. Well, you should. Well, they should ask you for dental insurance more, because you know how the dental insurance works,
Right.
especially through Medicare. But whoever is looking for dental insurance should look at few things. One, like you mentioned, whether they should find the dental insurance that is PPO plan, or DMO or HMO plan. So HMO or DMO dental plans, or insurance plans, is basically a plan where they're designated to a provider providing dentist. So their benefit only is valid, or they have a better benefit received if and when they go to that designated dentist that they're assigned to. If you have a PPO dental plan, it's they're a little bit more free to visit other dentists as long as they're PPO plan provider. Then they can go there, and then they can receive the dental benefit they sign up for. Oftentimes, the PPO plan will also allow you to go see dentists who are not part of the provider network. So they don't have to necessarily go to the PPO provider, but they can go to any other dentist they want. But once again, the dental benefit or insurance benefit will be less than when they go visit their PPO plan provider. But
Yeah.
they do have a choice as to who they want to go see, as long as the dentist they want to go see is a dental PPO plan provider.
Yeah. One of the things I always tell my clients is like, you need to ask your dentist
You're right,
what plans they take.
right,
And you need to find out because some dentists only take PPO, some only take
right,
HMO, some will take a combination of.
right,
But when you're looking at dental plans, I would say a couple of things that you should be looking for is, how much are the premiums?
right,
How much dental work do you have to have done?
right,
Because a lot of dental plans have a cap on them,
right.
and the caps aren't really very high.
No,
And
not for dental insurances.
no,
Um, yeah, so depending on how much dental care you need or treatment you need, you should pick out the one that would suit you. But if you certainly want to go see a certain dentist and want to have a dental insurance benefit, then you should check out what insurance plans that the that particular dentist take. You're right. There's a myriad of dental insurances out there, like PPO, DMO, HMO plans. So some dentists or bigger corporate dental offices, they actually take every possible dental insurances that are out there. More some dentists are more selective in their picking out the dental plans that are that they want to become a provider for. So yeah, make sure that the you understand which dentist is taking what dental insurances and what dental treatments that you need, so that you can properly kind of pick a the plan that can fit your need. And certainly you can help Janice, you can help them to
oh, I
do that,
can
right?
help them in
Yeah,
that definitely.
yeah,
Okay.
yeah.
But when looking for it, you want to know what the cap is, if they have
Right,
a cap. You want to know, exactly what it is. If you don't need a lot of dentistry, I'm really
right,
honest with my clients.
right.
I would say don't pick it up. If you go to the dentist twice a year to have your teeth cleaned,
Yeah,
uh, I prefer would pay it out of pocket.
right.
Yeah.
Yeah,
If you need to have dental work done, look at it, but definitely, as I keep saying, know your cap. If
yeah,
you're in the Medicare world and you have Medicare Advantage plans, uh, some of them will cover some dentistry. So
Right.
you just need to know what the plan is, and uh and and know exactly what it's going, what it covers and for what your needs are.
Yeah.
Uh it's very confusing, and it's dental insurance is not like regular health insurance or the Medicare insurance at this time.
Right. They have a different structure, but certainly you'll receive some benefits. So so if you have, but if you have a lot of dental treatments that's needed, it's sometimes it's not maybe even worthwhile to have a dental insurance because, like you said, there's a certain yearly cap that you receive. So if you only have, let's say, $1,500 benefit per year, and your crown cost for the dental insurance patient is about, let's say, 1,000, and if the insurance covers that 50%, that is to say, at $1,000 crown cost, you have to pay 50% of that, which is 500, and the dental insurance will cover on the other 500, and that goes into that adds into the, or that is a part of the $1,500 yearly benefit that you will receive. So
Yeah,
in that scenario, you can have three crowns done with dental insurance that particular year, uh, and given that you have $1,500 of copay
yeah,
for there. But if you have, let's say, all your teeth, let's just say you have 20 plus teeth that are in need of a dental crowns because, for whatever reason, severe attrition, dental decay, or whatever the case may be, then that's not enough to cover the full cost of the having 20 crowns done, because of because the dental insurance will only cover $1,500 a year. But you can certainly try to maximize the yearly benefit by having some of the work done towards the end of the year, and use the new benefit that's coming up in the new year, and you can try to kind of add those two benefits together by having the treatments done both at the end of the year and the beginning of the following year. Yeah.
okay. And the other thing you need to watch on for dental insurance is some of them have waiting periods.
Yes.
Yeah,
So, like a crown that we just talked about, some of the dental insurances will have 6 month waiting period. So they want to collect 6 month worth of a premium before they give you the benefit, or pay
right.
out the 50% of the benefit they promise.
Right.
Right. Yeah.
So that's some of the things that you should know when you do purchase, if you do purchase standalone dental insurance,
Hmm.
is to know exactly, what the premium is, what your needs are. Okay.
Right.
Find out if they have a waiting period, because I've even seen some of them where they can have a 2 to 3 year waiting period, and that doesn't help you if you're sitting there with an abscessed tooth.
Right. Well, obviously, if you have an emergency, they'll cover something like some of those dental emergencies.
Yeah.
Especially if you have to have a tooth extracted because of the abscess, then they'll certainly will cover that at their given benefit, whatever the rate. But anything that are considered selective or elective, or what they call the major dental work or dental procedures, they will certainly will have a waiting period, and that you should be aware of how long that may be. Sometimes you can pay a little bit more in your premium in order to get rid of that waiting period, but it you're gonna have to weigh the risk and benefit, so that yeah, you can have the proper assessment as to what you should be paying as your dental insurance premium versus what benefit you should be receiving.
Yeah. So I think you need to know the premium. You need to know what the cap is. You
Yes.
need to know if there is a waiting period. I
Mhm.
know in the Medicare that provides dental insurance, either HMO or PPO, I'm not seeing waiting periods. Okay,
Yeah, that's good. Yeah.
that that's
Mm,
in the standalone.
mm,
But just be careful and look at what you're getting when you purchase it, because I have
right.
people call me up and I'm going, I'm sorry. I mean, they'll be really upset, and sometimes they're not even my clients, and I'm going, that's what it is. I mean, there's nothing I can do about it. But
Yeah.
but
Yeah,
you
so for the seniors, I think it's great that the Medicare allows you to sign up for dental PPO plans through a third party provider,
yeah,
insurance provider. But if you're an individual, there aren't too many. As far as I know, there aren't too many dental insurance plans that are out there for an individual to purchase. It used to be more of a group plan where the larger corporate will sign up with the dental insurance companies to provide the benefits for their employees. But I'm seeing less and less of that unless you're in a sort of a government job or teachers union or something like that. But for regular the individual who is not part of any major corporate may not find those dental plans so easily.
well, they're out there. I know they're available.
Yeah.
Uh, they're also expensive,
Yes, the
and
premiums
a
way
lot of
high.
people, I mean, they go, why bother? Unless you're
Right.
having a lot of dental done.
Yeah.
And I'll talk to people and say, I have so much dentistry that needs to be done.
Yeah.
Okay. So that's it's important you just know what you're getting. So let's just take a couple of minutes and let's talk about our series that we're doing.
Mm,
And Dr. Tim is going to come on a monthly basis, and we're going to talk about something different. So we talked a lot about insurance this time. We talked about very basic dental needs today, and in in the future, we're going to talk about a little bit more detail.
yeah. Uh,
So
so next time, I think when I come back, let's talk a little bit more about how the medication, what certain medication will play a role in oral health, and
I,
how how the senior citizens should be more aware of those medications and how they would take different sort of approach to their dental care
yeah.
and oral care.
And I think I would like to also talk about, we talked a little bit about food, but we could talk more about food, but let's talk about those sugary sodas and and even alcoholic drinks, how they affect your mouth, how they affect that oral health,
Hmm,
along with the medications. And I know there's some myths out there that we would like to talk about.
yeah. Well, one thing that's out there is that a lot of people talk about whether a tooth will melt in Coca Cola or not. I know some people have done that kind of experiment. Some maybe out there, on YouTube. But it takes a lot more than just dunking a tooth into the Coca Cola to melt the tooth away. But it does happen. It does happen.
I think
But it may take long time for that to take place.
we're going to talk about that in a little bit more detail. We'll try to have some fun subjects because we know this is not the favorite subject of everybody, but
Hmm.
everybody, I know I was always brought up that you need to go to the dentist every 6 months, and I think that makes a difference.
Yeah,
So, but there's a lot of different subjects. We can talk about how
sure.
dentistry can affect your heart. We can talk about, when you have surgeries, what happens when you have surgeries, because I had a knee replacement and that's affected my going to the dentist. Okay.
Yes.
And how your health and how it's treated when you go to the dentist. So we're going to have a bunch of different subjects on a monthly basis, and I'm hoping it's going to be the first Thursday of every month. Okay.
Yeah.
And we're, all's well. That's what we're going to be having. So I think this has been, as always, a pleasure to have you on the show, Dr. Kim. Thank you so much. I have the information on here and how you can get a hold of Dr. Kim. I know this is not a live show, this is a recorded show, but if you have any comments, please, we would love to hear from those comments. You can through the different avenues that we're on E360 TV or on Facebook, YouTube. We can accept comments, or you can call Dr. Kim if you have any information. Not only is he great personally to talk to, he's got a really great friendly staff that's there. Or my information was posted on this earlier. I'd be happy to help you out any way we can, but we would love to have comments. So please feel free to comment to us.
Mhm.
So I hope, Dr. Kim, it's always been fun. I'm looking forward to next month when you come back on again. This is great. And everybody, thank you so much for watching us. Thank you for spending time at a Senior Citizens Forum. And we'll see you again next Thursday with another great guest. Thank you.
Thank you, Janice. Thank you for having me. We'll see you next time.
Okay, great.